Let's now talk about urethral strictures. So the male urethra, where is it found, what's the anatomy of it, and how is it divided into the various stricture formations? So the anatomy of it is that within the corpus spongiosum you can see the urethra. Now you can find the urethra. The corpus cavernosa both surround the corpus spongiosum, and the corpus spongiosum is precisely where the urethra is. The corpus spongiosum is a spongious muscular tissue which surrounds the urethra. Now there are three different parts of the urethra we need to be aware of, which is the penile urethra, which is this part down there, and then you have the prostatic urethra at the top, which is surrounded by the prostate gland, and in between you'll get this intermediate urethra, also known as the membranous urethra. And when it comes to understanding where the injury is likely to occur, the injury or the stricture, so the penile urethra and the prostatic urethra are both surrounded by structures, this structure or that structure. The intermediate zone here in the intermediate urethra is not surrounded by any structure, meaning that it's more vulnerable to damage, more vulnerable to injury. So surrounding structures cover the urethra except in the intermediate zone. Any narrowing in the anterior urethra is known as a stricture, whereas any narrowing in the posterior urethra would be known as a stenosis. Here we can see within the corpus spongiosum there's a narrowing in the epithelial tissue. If it's in the epithelial tissue, it's known as a stricture. The stricture formation can occur either on the epithelial tissue of the urethra itself, or there can be a bit of fibrosis on the corpus spongiosum itself. If there's scarring or fibrosis of the muscle within the spongiosum, that's known as spongiofibrosis, and that would be considered an anterior urethra stricture. A posterior urethral stricture is always known as a stenosis. So these two parts are considered the posterior urethra. The intermediate or the membranous and the prostatic urethra are considered posterior. This is considered anterior. And just for your information, these two are divided by the urogenital diaphragm. So essentially, if it's a narrowing in the anterior urethra, it's known as a stricture. And if it's narrowing in the posterior urethra, it's known as a stenosis. And posterior urethra, let me just remind you, is the membranous urethra and the prostatic urethra. The posterior urethra stricture or narrowing or stenosis, it should be called stenosis, is typically due to pelvic fractures. So those are typically due to pelvic fractures here, especially in the membranous. The membranous urethra is the most at risk, vulnerable, and is typically caused by pelvic fractures. But typically in the anterior, it's spongiofibrosis. And within the pelvic fractures, there's structures that pull at the urethra, distending it, dilating it, pushing it apart, known as a distraction injury. So failure to catheterize these patients is a key suspicious marker for a stricture. Failure to catheterize, because imagine there's a stricture and it's essentially obstructing the urine outflow. And by the way, whenever there's a tube with a stricture obstructing the urine outflow, then if the urine is not passed out, you get urinary stasis. And anytime there's an obstruction leading to urinary stasis, you're going to get complications like a UTI, like an abscess formation, or like prostatitis, all due to urinary retention. What clinical features will we see in these patients? Well, you can either get a sign of you can get voiding difficulties, voiding symptoms like hesitancy, poor flow, weak stream. These patients will have a higher post-residual urine volume, and they'll have voiding difficulty. Investigations can also be with a retrograde urethrogram. What that does is essentially you inject contrast dye into the urethra, and then you can visualize that dye and where does it go up to. And if it stops at a certain point, you know that that is where the stricture is, or that is where the obstruction likely is. That's known as a retrograde, backwards, urethrogram. Now treatment would be with dilation. So treatment would be surgical, and because it's a narrowing, you can dilate it surgically, which is known as a urethral dilatation. And you can also go in and incise the fibrotic tissue with a knife, or you can excise it, and once you excise it, you have to rejoin the remaining urethra. So here it is, and let's say I take this out, and let's say I take this whole part out, I would still have to connect the remaining parts together, which would be the anastomosis. All right, thanks for watching.